There's another aspect there, which is telepharmacy. If we can talk a little bit about that, a common challenge when patients get discharged from the hospital, all of these new meds, and what about my old meds? When we see patients after that hospitalization, I always say, bring me all of the meds that are in your medicine cabinet so we can sort through them. How can you help with that too?
Okay, so telepharmacy is huge, and it's such an important and wonderful program that we offer. I want to say, first of all, that telehealth, whether it's the equipment I just showed you or telepharmacy, is free to the patient with Medicare. We provide this as one of our services. In order to qualify for telepharmacy, we just need your verbal consent to say that you'd like it. Basically, our nurse goes out, or our physical therapist, and they write down all the medications that you're taking. Those that were newly prescribed from your hospital visit or when you went to your PCP, and those that you were taking before. That's called a reconciliation. Basically, we want to look at the medication that you're supposed to be taking. There's often confusion with, I was just in the hospital, they sent me all these new ones, I don't know if to take the new, the old, both, or none. And often patients tell us, I'm just going to wait till I have my follow-up appointment next week to decide. And 7 days might be too long. It's also the #1 reason why patients go back into the hospital is because they didn't understand their medication. So that's where home health can really be a benefit to you and your loved ones when they go back home. Just alone, that bridge is important. So telepharmacy, the nurse writes down all your medications. We leave it in the home for you, and we also put it into our computer system. Our pharmacist then, with your consent, looks at all those medications, and we set up a phone call. It could be 7 days a week at the time and date of your choosing. It could be either via the phone or with an iPad, so that you can actually see the pharmacist, as you saw in the video before. And that pharmacist is going to take the time to speak with not only you, but any of your family members that are involved in your care. We want to bring you into your care. This is your disease process. This is your livelihood and your quality of life. And it's very important that you take accountability and that you take action within your own health care.